the Medical Watch now, maternal deaths across the U.S. more than doubled over the last 20 years. A new report is shedding some light on this increase and how it's affected Black, American Indian, and Native Alaskan mothers in disproportionate numbers. Dr. Allison Bryant is the co-author of this new report and an obstetrician, also a senior medical director for health equity at Mass General Brigham in Boston. She's joining us now live. There you see her with a little bit more on this report. First of all, hello to you.
Hello, Lourdes. Nice to have you.
Nice to have you here with us. Okay, let's talk about this report and the data that you were able to find.
Sure. These were data that we looked at over the past 2 decades that really looked at maternal mortality rates across the United States, parsed out by state as well as by race ethnicity. And so it tells a similar story that rates of maternal mortality in the United States are unacceptably high and have been on the rise, and that they are disproportionately sort of burdened by different races and ethnicities. So in particular, Black individuals, but really a group that we haven't paid, I think, quite as much attention to nationally, which is American Indian Alaska Natives.
Okay, and you said you looked at state by state how those numbers were shaking out. What did you find for Illinois, for example? Is it fall in line with what's happening with the rest of the country?
It does. Illinois looks a lot like the rest of the country. So I think in the Midwest, rates are sort of average for the remainder of the country. In Illinois in specific, if we look over the time course that we looked at, the rates actually were fairly low as compared to other states. But I do think that there are inequities that Illinois is going to want to take a look at. So in particular, over that time frame, there was a significant increase in deaths to American Indian Alaska Natives. And so that's a population, again, that I think is deserving of much more intense study and sort of understanding what's going on within those groups and how we can help best to support individuals who are pregnant or after pregnancy.
All right, and when you look at numbers like this and we talk about them, we can't forget the why, right? So I'm wondering if you have any ideas as to why this is happening and why those particular groups seem to be targeted or seem to be affected by this more than others.
Yeah, so I think that that's the million-dollar question. I mean, we know that over the time course of this and sort of, even looking further back, that individuals are giving birth sort of later in life. And so that may contribute to increased risks of things like chronic conditions during pregnancy, as well as perhaps poorer access to healthcare. And we certainly know that there's lots of inequities and structural racism that's based into the care that we deliver, into the ways that folks access healthcare. And so I think that that is some of a large part of the explanation of why things are so disproportionate amongst American Indian, Alaska Natives, and Black individuals is that we know that there's a legacy of structural racism in the policies that keep people healthy or keep people from achieving their best and their optimal health that we really need to address as individuals contemplate family building and sort of move through the pregnancy and the post-pregnancy period.
Yeah. We've got about 30 seconds left, but I want to ask you, it seems like we've had these discussions before, certainly in the last 2 decades. And for many people, they would think that the numbers were getting better. That obviously from your research is not the case. Do you feel like things are changing and things are improving and something's being done to address this?
Yeah, I think we do have a bright spotlight on maternal mortality that we can't let up from. And so I do think that we thought that there was some plateauing of the risk of maternal mortality up until around 2019, with the exception of for American Indian Alaska Natives. So it's possible that some of our interventions were starting to work, but we certainly know that the pandemic certainly had a negative effect on maternal mortality. So there's so much more to be done.
Long way to go. Okay, Dr. Allison Bryant, we appreciate your time. You can read a little bit more about this report on our website, WGNTV.com. Have a good afternoon.